Hello, my name is Karen Odegaard, and I'm an action learning coach with the County Health Rankings and Roadmaps program. Welcome to the Making the Most of the 2019 County Health Rankings webinar. This webinar will help you prepare for the rankings release on March 19th, both from a data and a communications perspective. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. We have a team of CHR&R staff here for you today to make sure that you have the information you need to be ready for the March 19th release. So let me welcome Amanda Jovaag, our Rankings Team Director.
Hi, Karen.
Hey, Amanda, thanks for joining us. Kate Conkle, our Team Director for Community Learning, who will be facilitating the question and answer portions of our time together.
Hey everyone, it's good to be here. Glad you're joining us.
And then we also want to recognize that Keith Januso, our Rankings Lead Scientist, and Annie Rubel, our Population Health Analyst, are joining us today as well, and we'll be helping to answer your questions during the webinar. So you may see their names pop up in the question or chat boxes. Also, Joe Hinton, another action learning coach, will be helping behind the scenes on chats and questions. So just a heads up if you see his name popping up in your chat as well. And finally, James Lloyd is helping us out with technology today. So if you run into any problems with Zoom, let us know and James will help to make sure that you're able to stay connected. And that's your team for today, so welcome. Let's take a look at what we want you to get out of today's webinar. First, we want to share some of the new features and resources from the 2019 County Health Rankings. We'll give you some tips for using featured tools and resources. And we'll discuss some strategies for how to leverage the rankings release to spur action in your community. We'll have time for questions, so please feel free to enter your questions in the Q&A box at any time. I also want to let you know that directly following today's webinar, we will offer 2 extended Q&A sessions, one with Amanda and Kate that will primarily focus on the data side of things, or you can join Annie and me to talk more about using the rankings to move to action. If you have questions about both or want to discuss both, either room will work. We invite you to share your experiences and ideas for the upcoming release with us during that time. And we'll provide links for each session in the chat toward the end of the webinar. So there's no registration required, and the links that we send out in the chat will take you directly into the Zoom meeting room. So watch for those later in the webinar. These post-webinar conversations give you the chance to be face-to-face with other attendees and to share what you're doing locally, as well as ask questions of us and other participants. So again, watch the chat for details about how to connect later in the webinar. So when we talk about our data resources, the first thing that usually comes to mind for people are the rankings. I'm going to just turn on my laser here so we can walk through this model. This picture shows the thinking behind the rankings. It shows us how rankings can be a catalyst for action that improves the health of everyone in a community. And we start with population-based data from a variety of sources. We use that data to rank the health of nearly every county in every state. Ranks are great for garnering attention. And each year the rankings report releases, generates national, regional, and local media attention. It also provides an opportunity for people to tell the story of the many factors affecting health in their community and what's going well, and as well as thinking about where there is opportunity to make things better. And you can use this information as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. Based on this deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. And over time, these strategies ultimately result in longer, higher quality lives for everyone in the community. So essentially, the county health rankings aren't just about numbers, they're also about a call to action. And you can use the county health rankings release and the attention that comes with it as a way to either start or continue a conversation about health. And I'm going to be talking later in the webinar about how you can use it as a call to action. But first, we'd love to hear from you how you've used the rankings release as a call to action in the past. So you can share your experiences with us in the chat. During today's webinar, we're really going to be focusing on this horizontal portion up at the top. Thinking about this opportunity that comes from the data that we released on March 19th as part of the County Health Rankings data release. And we're going to start by talking about that data. Amanda, I'm going to turn it over to you so you can help us think about what is new this year and how we can use this data.
Hi, everyone. This is Amanda. So data is a resource that can be used all throughout community health improvement processes. It can be used for uncovering health issues in your community, finding where and with whom they're located, and getting to the root causes of issues. The rankings can help your community with all these issues. And I see that Joe asked a little bit about how you've used the rankings release as a call to action in the past. If you chat those in, we're going to talk a little bit about those later, okay? So go ahead, feel free to chat those in. Next slide, please. Today we're going to help you maximize your use of the rankings data. First, we'll talk about what goes into the rankings data. Next, we'll take a quick tour of the current website to visit some don't miss tools. This year, we're adding several new measures, both ranked and unranked. I'll introduce those measures and talk about a new website feature that we're all really excited about. And finally, I'll talk about updates to our state reports that continue to highlight our program's focus on achieving health for all. So let's get started. I'm going to start with the model that underlies the work of the rankings. One of the goals we've had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things we often think about when we hear the word health, like healthcare and how well we eat and how much we move. But we also know it's things like education and income, quality of our housing, and the safety of our neighborhoods. Starting from the bottom, we know from research that effective local, state, and federal programs and policies can improve a variety of factors that in turn shape the health of communities. Many health factors, that's the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We also measure two types of health outcomes. Those are the green boxes that show how healthy each county is: length of life and quality of life. So how does that model translate into measuring health in counties? We have 35 ranked measures. We are now chatting out a link to a PDF of this year's ranked measures, their data sources, and the years of data we were able to access. Please feel free to open the file to follow along as I briefly point out the areas that we measure. Okay, so there's that link. So to measure health outcomes, we have 1 measure of length of life and 4 for quality of life. Health behaviors includes 9 measures of smoking, diet and exercise, alcohol and drug use, and sexual activity. Clinical care includes 4 measures of access to care and 3 measures of quality of care. The social and economic factors are measured with 9 measures of education, income, employment, family and social support, and community safety. And the physical environment includes 2 measures of air and water quality and 3 measures of housing and transit. Our measures are selected using a variety of criteria. Measures must meet some technical and feasibility criteria, as well as be appropriate for our program's goals and meet community needs. Technically, measures need to have a strong length of health, be available at the county level for nearly all counties in the nation, and have a relatively short time lag. To meet our goals and community needs, measures must reflect a modifiable aspect of community health. They have to be easy to communicate. And with the mindset that fewer measures are better than more, any new measure must bring added value without diluting the model. If you're interested in learning more about our criteria, we are including a link to a document that lists all of them in a PDF of our resources. So if you open a list of the measures, you're seeing that there's almost as many data sources listed as there are measures. This here is a list of some of the more than 20 data sources that the county health rankings rely on. This work couldn't be done without the many state and national organizations that calculate and compile comparable local data for counties throughout the US. I want to give particular thanks to the BRFSS and the National Center for Health Statistics at the CDC for the data that they calculate and provide to us each year. Thanks to all of these sources. So that's a quick and high-level summary of the measure and some of the methods we use to construct the rankings. In order to give us the time to help you get the most out of your rankings, we're skipping a more in-depth look at the methods. If you'd like that deeper look at the methods behind the rankings, watch the 20-minute webinar that we've recorded that describes how we rank in specific. The link to that webinar will be included in our PDF of resources. So let's move on to a demonstration of how to maximize your ranking snapshot. As we've worked with communities throughout the years, we've found that many have not taken advantage of the various tools and resources we've added to the rankings website. So we'd like to take a quick walkthrough of these resources live on the website. I'm going to now share my screen here. This will take just a second, okay? Okay, so everyone should be seeing a snapshot of Brown County, Wisconsin. I picked Brown County. It's where I grew up, so go Packers. It's where Green Bay is. We're going to take a look at this. It's just an example of any of the counties in the nation and walk through how I look at a snapshot when I'm trying to help a community understand it. So the very first thing I usually look at is the trend graph for premature death. I'm going to click on that. Well, first just note it's yellow, which right away tells me that over a long span of time, about a decade, premature death has not been statistically changing in Brown County. If you look at the graphic, you see lines for Brown County, Wisconsin, and the United States, and there has been no significant trend for Brown County for this measure. I start with premature death because it quickly gives you an overall sense of the health of the community. So you might be wondering what's causing these premature deaths. A few years ago, we added a resource where you can quickly see the leading 5 causes of death under age 75. These are the deaths that contribute to premature death in each state. It can really help you understand what is causing these premature deaths and give you a hint to what you might want to look into. So do you know that in addition to our 35 ranked measures, we also include on each snapshot about an equal number of measures that are not used in calculating the rankings? I'll show you here. If we have several little plus signs that will show you a whole host of additional measures. These additional measures are included for a variety of reasons. Some provide additional context to the ranked measures. Some are measures that we might otherwise include in the rankings, but that are only available for a minority of counties. Some are unrankable measures. An example of this from last year is healthcare costs, which is an important measure for communities, but one where it's not clear if more or less spending is good for the community. And finally, we include easy access to some basic demographic measures of your county that can help provide context to understand the rest of your snapshot. I'll just open those up real quick here. So in the past 2 years, we've added a number of ways to help you understand your measures more deeply. We added ways to look at your data by different race and ethnicities within counties. Anywhere that you see a blue link, you can click on it and see not only the overall rate, but rates for the racial and ethnic groups that we could access data for. This really helps you understand the differences in how health varies within your county itself. We're going to talk a little bit more about this when we talk about the state reports. One final and maybe the most important feature is the Programs and Policies tab. So if you click on any of our health factors, I'll just click on adult smoking here. You get a lot of information about these measures, but if you click on policies, these data are intended to guide action, and this tab leads you to a curated list of programs and policies from our What Works for Health database that are related to the measure that you're looking at. This year, we've been working to create tight links between measures and approaches, and we've been adding policies to our additional measures where it makes sense. So hopefully you've learned about one new tool or area of our website that you haven't explored before. Okay, I'm going to go back to Karen here.
All right, great. Thank you, Amanda. You laid out a whole bunch of features that often we hear from folks are new. So we wanted, are new to them, things that they haven't used before. So we wanted to take a quick poll to hear from all of you to see which parts of your snapshot, which features that Amanda just walked through will you use this year? And you'll be able to check all that apply. So James, I'm going to ask you to launch that poll. And there it comes. I think it's always nice, especially at this time of year, Amanda, to get that reminder of all of the different things that we can do with the different features that are available for a snapshot.
Yeah, I know in my work with communities, there's just such a rich, this is such a rich source of information. It's really easy to miss some of the features that are available. Yeah, even in my summary, I neglected to note the Spanish translation. My apologies for that, everyone. But I can see that lots of people are planning to use it anyway. The snapshot has been translated into Spanish and is easily available just with a click of the button.
Yeah. Let's just give it a few more seconds, and then I'll have James share the results with everyone. And why don't you go ahead and close the poll and share those results. So we can see that those trend graphs are very popular. People are really looking forward to using those this year, as well as the causes of death, the policies and programs, which as you pointed out, Amanda, I think is really key for thinking about how do you use this data to start to move toward action, to drive action, and that link directly to policies and programs is a really great way to move in that direction. And then the demographic data is also really, people are looking forward to using that as well. So fantastic, this is great. I'm glad that people are finding the features useful. All right. And I think, Amanda, why don't we, before we head into what's new in the 2019 ranking, since we're chatting a little bit here, Joe, can you let us know a little bit about what you're seeing in the chat? We asked folks how they've used the rankings as a call to action. What are you seeing?
Yeah, thanks, Karen. We've got a lot of experienced practitioners in the room with us today. And Karen started us off just to say that it's a great way for us to check how we're doing in our community. Mary offered the rankings release as a community engagement moment to work with county commissioners. Timothy offered up comparing data with hospital and foundation health surveys. Lots of application towards community health needs assessment and towards messaging for the community. So lots of great answers out there.
That's great. And I'll just note that when we get a little further into the webinar, we'll be talking about some different strategies for using the rankings as a call to action. And for those of you who have a lot of experience with this, I invite you to continue to share your expertise using that chat as we get into talking about some different strategies for leveraging the rankings as a communications tool. But for now, I'm going to send it back to Amanda.
All right, thanks. It's really great to hear about all these stories. We at the data team part of the rankings just love to hear how people are using the work that we do. So thanks for chatting all those in. So with all the tools that I mentioned, what are we adding for the 2019 release? First, we have several new ranked measures. This year, we're adding a new data source for our measures of healthcare quality of care. Previously, we relied on data from the Dartmouth Atlas of Healthcare, but this source is no longer available. This year, we have 3 new ranked measures using a great data source called the Mapping Medicare Disparities tool. This tool is developed by the Centers for Medicare and Medicaid Services and offers data on a range of measures of health, utilization, and spending. These data are available at the county level and can be explored for areas of disparities between subgroups of Medicare beneficiaries, for example, racial and ethnic groups. The 3 new measures of healthcare quality are preventable hospital stays, mammography screening, and flu vaccinations. You may notice that the first 2 of these measures have not changed names, even though the data source has changed. Preventable hospital stays remains a measure of the rate of hospitalizations for ambulatory care-sensitive conditions. However, this year, conditions included in this measure differ somewhat from those included in the earlier measure from earlier years of data. The values for your county will almost certainly change, and you should not compare these values with earlier years of rankings data, even though the measure name has stayed the same. Mammography screening remains a measure of the percent of women covered by Medicare receiving a mammogram in the past year. However, the age range included in this measure has grown from the ages of 67 to 69 to the ages of 65 to 74. Given that some organizations recommend fewer mammograms as women age past 70, you may find that your county's screening rate is lower with this new measure. Like with the preventable hospital stays, you should not compare these values with earlier years of rankings data. We are happy to note that this new data source provides data for the last 5 years, which means we can continue to provide trend graphs for these measures so you can still get a sense of recent change in these measures over time. The last new ranked measure this year is flu vaccinations. This measures the percentage of Medicare fee-for-service enrollees who received an influenza vaccination in the past year. This measure has been added and recognizes the importance of regular vaccinations as a measure of the quality of clinical care. Influenza is a dangerous disease for seniors, and annual vaccinations are recommended for all to prevent infection. This measure also has trend graphs available. You might notice that we're no longer measuring diabetes monitoring. We continue to believe in the importance of chronic disease monitoring in determining quality clinical care. However, we're no longer aware of a national source for local estimates of diabetes monitoring. We've gotten some questions already about how much rank change can be expected considering the addition of these new measures. As in all years, rank changes result from a variety of factors, including underlying changes in health factors in your county, changes in other counties, or due to changes in our measures or methods. And this year, like every year, in order to understand your county's ranks, you need to look closely at the measures, your trend graphs, and any methodological changes like the ones I just outlined. We're very excited about this data source and hope you find it as useful as we have. In addition to 3 new ranked measures, we have several added new unranked measures. The first is life expectancy, a measure of overall health that is being used more and more in local communities. This year, the National Center for Health Statistics released a first of its kind neighborhood level data on life expectancy, which shows that life expectancy estimates vary greatly even at the census tract level from block to block. We add this to our suite of mortality measures, including years of potential life lost and infant and child mortality. We're also including 2 new measures of housing affordability and stability. Severe housing cost burdens is a measure of the percentage of households that spend more than half their income on housing costs like rent, mortgages, insurance, and taxes. There's a strong and growing evidence base linking stable and affordable housing to health. As housing costs have outpaced local incomes, households not only struggle to acquire and maintain adequate shelter, but also face difficult trade-offs in meeting other basic needs. This data comes from the American Community Survey. Home ownership is the percentage of households that are owned rather than rented. This data also comes from the American Community Survey. Home ownership has historically been a springboard for families to enter the middle class. Owning a home over time can help build savings for education or for other opportunities important to health and future family wealth. High levels of homeownership are associated with more stable housing and more tightly knit communities. This year, our state and national reports will call attention to the role of housing in our communities. These two new measures can help start or continue a conversation on meeting the needs for stable and affordable housing in your community. One more adjustment is a definition change for disconnected youth. In earlier releases, the disconnected youth was defined as the percentage of people ages 16 to 24 not in school and without a job. Using a new data source, we now measure disconnection among those ages 16 to 19. It's a small change, but it means that the data this year will not be comparable to earlier years of data. In addition to our new measures, we've been hard at work on website enhancements that we hope users will really enjoy. One that I hope you'll explore is an improvement that brings our model front and center. The model is so fundamental to our work, we want users to be able to easily see how each piece of it fits with the others. Throughout the website, you'll find links to this new interactive model. In this model, you'll be able to easily explore all our health outcomes and health factors. You can learn about each of the boxes in the model while keeping a visual reminder of how the topic fits into the whole. In addition, this model will give you a new way to learn all about our measures. At the County Health Rankings, we've always valued transparency. Now with just a few clicks, you can see all the details about our measures while continuing to see how it fits into the model. And here you can see, once as you're using this model, you're going to be able to see how the focus areas fit into our factor areas, how it fits into the whole model, and how the measures fit into that picture. Here we are. Okay, so in our new and improved measure documentation that comes with this model, you'll be able to easily get answer to some of our most commonly asked questions. Who's counted in this measure? Sometimes it means, does this measure count people just who live in this county, or maybe where something happened to them in this county? People often ask, why is this value empty for my county? We talk about suppression criteria. You're going to find information on how can I use each measure to track progress, and how can I dig deeper into this measure? Where can I go to explore? All of this information is going to be available much more quickly and easily by using our new and improved measure documentation. Please be sure to take a look at this new model and their new measure information. You'll find links to it throughout the site, and you can access it easily from the Explore Health Rankings page. I'm going to talk a little about the 2019 state reports. Last year, we completely changed our state reports to provide these resources with added value to communities while emphasizing our growing focus on ensuring not only health for all, but health equity as well. Our county health rankings have been illustrating for the past 9 years that where you live matters to your health. The new state reports take this a step further and show that health not only varies depending on where you live, but can also vary depending on your race and ethnicity. Our goals with these reports are to discuss what health equity is and why it matters, differences in health outcomes within the state by place and racial and ethnic groups, differences in health factors within a state by place and racial ethnic groups, and what communities can do to create opportunity and health for all. So what do we mean by health equity? I think it's worth just reviewing this again. This was a new addition to our state and national reports last year, so it's probably worth revisiting this. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty and discrimination and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. We're going to be using these state reports to look a little more closely at health equity. So in these reports, you'll find a series of graphics that illustrate how health outcomes and some health factor measures vary among counties and among racial and ethnic groups throughout the state, within states. In this graphic, for example, you're looking at differences in the overall measure of length and quality of life by place and among racial and ethnic groups within this example state. It shows that in this example state, meaningful health gaps persist not only among counties, but also among racial and ethnic groups. For example, Black and Native American residents in this state have poorer measures of health outcomes than Asian, Hispanic, or white residents. You can also see that length and quality of life values for Black residents are most similar to those living in the least healthy quartile of counties. These graphics are going to look different for every state, and you may find that the story of health outcomes in your state is quite different. In some, the differences among counties are much greater than the differences among racial and ethnic groups, while in some states, those differences are substantially smaller. We're going to move beyond just looking at health outcomes to what's causing those important differences in health. Health is influenced by a range of factors. However, social and economic factors like connected and supportive communities, good schools, stable jobs, safe neighborhoods are foundational to achieving long and healthy life. These social and economic factors also influence other important drivers of health and health equity. In the next section of the report, we focus on 3 measures that illustrate the opportunity for health important to all people. These graphics, similar to the example here, using child poverty, severe housing cost burdens, and home ownership, will allow readers to explore differences in measures by place and difference by racial groups, and to examine patterns across measures in the size and nature of these gaps. The key takeaway is this: whether we're talking about place or racial gaps, both need to be addressed, and when working to improve community health. We ask you to consider these questions as you look throughout these state reports. What differences do you see among counties in your state? What differences do you see by racial ethnic groups in your state? How do counties in your state compare to all U.S. counties? And what patterns do you see? Do some racial and ethnic groups fare better or worse across several measures? And what can you do to improve health and equity in your county or your community or your state? So these reports don't stop at identifying the problem. You'll also find strategic approaches to improving opportunities to be healthy in communities throughout the U.S. I hope you'll take a look at our fantastic What Works for Health tool that we talked a little bit about in the snapshot to learn more about strategies that address all health factors that make up the rankings model. A link to What Works for Health will be included in the PDF of resources for this webinar. So thanks to everyone for walking through what to expect in the 2019 release. I'm going to hand it back to Karen now.
Great, thanks so much, Amanda. I think we are going to just take a few minutes here to see if we can maybe answer 1 or 2 of your questions before we dive into a little bit more about how you can leverage this data. Kate, what questions have you seen coming in?
Yeah, so Annie and Keith are doing an awesome job of answering questions via text, but a couple that might be helpful for the full group coming in. So the first is, how can I compare my 2019 data to the previous years?
We get this question a lot, and it's one of the reasons that it's one of the pieces that we've really emphasized in our new measure documentation. That question really varies from measure to measure, whether you can use how to use each measure to track change in communities. One tool that I want to make sure we point out in this context is the trend graphs. We work really hard to ensure that as many measures as we can, have trend graphs available to make that tracking that change over time available to communities. The entire data set of all of the trend data is available on the website. And since last year, the trend graphs have data tables so you can see the full data for your county, for your state, and for the nation as you're looking at your trend graphs. So that's really where I want communities to start. Beyond that, it's going to be very helpful to look at each individual measure's documentation to really understand how to use that measure best to track change. One thing, sometimes people ask that question and what they really mean is, how can I use the ranks to track change over time? And I just think it's worth pointing out again, ranks are a great tool, but there are significant, there's some significant weaknesses in tracking them over time, because differences in ranks can result from so many factors: changes in your own measure, changes in methodology, changes in other counties' values. So we always try to encourage our users to go to the measure data itself. That is the first place to start.
All right, thanks, Amanda. Another question coming in, we've seen lots of references to equity and people thinking about disparities in the chat. So a question about how can communities use their rankings to address equity?
Well, that's a great question. We've really been working hard to add so many tools. We now offer disaggregated data this year for, I think, 14 of our measures, which can really just give you a starting point for understanding how health can vary for different racial and ethnic groups within your county itself. I think the state reports are another great resource for you to use. They don't only offer the data, which is a great place, but they also offer ideas for what communities can do to make these changes. And they can give you a real sense of the bigger picture within your state. I think the rankings offers a great way. I think just the rankings emphasis on the social and economic factors, on the ways that we emphasize the opportunity to be healthy, the opportunities that everyone needs in order to be healthy, is a great way to start the discussion around health equity. So again, relying on the model is another place that that the rankings can really help you in your discussions about providing opportunities for health for everyone in the community.
Great, thank you, Kate, for sharing some of those questions with us. Thank you, Amanda, for your responses, and a big thanks to Annie and Keith for doing such a great job keeping up with the questions directly in the Q&A box. We will have another opportunity in just a few minutes to ask more questions, and then also I wanted to remind you all that following today's webinar, immediately following today's webinar, we'll have the opportunity to go into Zoom meetings where you'll have more time to ask Amanda questions or to chat with Annie and myself about how to use the rankings in your community. So I want to talk a little bit about leveraging the rankings and other resources for action. We know that the power of data comes when you use it to drive action. So we're going to talk through some tips and strategies for making the most of the rankings release and using it as a call to action for you and your community. So remember that, thinking back to that, that logic model of how we think about the rankings and what we do here. One of our primary reasons for ranking is that it's provocative, and we want to get people talking. Ranks are great for garnering attention, and communities can use that attention, the attention that the rankings generate, to tell their story through the media. Many communities take advantage of media attention by talking about current efforts to improve health. Communities can also use the attention that the rankings generate to connect directly with other community leaders and partners that they want to engage. When Joe shared some of your stories about how you're doing this, that's what part of what I heard, people talking about using it to go to their community leaders to share what was happening, and also as an opportunity to invite others to join you. It's also an opportunity to start or deepen conversation in your community about health and equity. So we're going to walk through 4 simple steps to help you prepare to leverage this year's rankings release as a call to action. One of the key messages of county health rankings and roadmaps is that everyone has a role to play in improving health and advancing equity. The rankings release is an opportunity to connect or reconnect with stakeholders in your community. So think about who needs to hear your message. And when you're thinking about audiences, you can think about a few different groups of people. You can think about partners. These are the people who are already involved in your work. It can include your leadership team, your members, volunteers, funders. You can also think about potential partners, people you'd like to engage in your work now or in the future. This image shows some of the key potential partners that you might consider reaching out to if you don't already have relationships with people in these sectors. Decision makers. These are the folks in your community who are making decisions. This can include both elected officials or organizational leaders. And influencers, the folks who influence decision makers in your community. And this might include community members, people who read your local newspaper, and voters. So I want you to think about the rankings release. Which audiences might you want to reach this year? I want you to go ahead and use the chat to share at least one group of stakeholders that you're hoping to reach with this year's rankings release. So once you know who you're trying to reach, think about why. What is your purpose and what is your call to action? Do you want to share knowledge? People need some basic knowledge on an issue before they can consider taking action. You share knowledge when you tell your story through the media. And many communities take advantage of any media attention they get by talking about current efforts to improve health. Maybe you want to encourage action. You could use the rankings to make the case to a community leader or a partner that you're trying to engage to make the case about why they have a role to play in creating a healthy community. This is an opportunity to invite others to join you. Or perhaps you want to celebrate. This includes celebrating victories with the people who help make them happen. If your supporters see the impact of their action, they will be more likely to act again. So think about what good things are happening in your community. Use the rankings release as an opportunity to talk about the importance and the value of existing efforts or partnerships. And once you know who you want to reach and why, think about what you will say. How will you motivate your audience to listen, to care, and most importantly, to act? As you develop your message, remember, you control the story. So think about what story you want to tell and tell that story. One of our favorite tools for creating messaging is called 2793, and it comes from an organization called M&R. You'll find a link to this resource in the resources document for today's webinar that will come out later this week. I highly recommend that you take a look at that tool and think about using it to help you craft your message. You can also focus on action and assets. What are you already doing? What are the strengths of your community? And include a call to action that gives your community an opportunity to get involved. You might be concerned about the fact that your county doesn't rank well, and that's understandable. Being a low-ranked county doesn't mean your story should focus on what's not going well, though. You can use the rankings as an opportunity to highlight the good work that's going on and as a rallying point. 2 of our RWJF Culture of Health Prize winners are also low-ranking counties in their states: the Bronx in New York and Menominee County in Wisconsin. But both of these communities have used their low ranks as a rallying point. And they've done a lot of great work in their communities, so much so that they both have been recognized as RWJF Culture of Health Prize winners. So a quick and important takeaway is that being low ranking doesn't mean that there isn't great work happening. So share those stories. Make that your narrative. And finally, reporters may ask why your county is ranked at or near the bottom. It's okay to acknowledge some of the challenges your community faces. This gives you the opportunity to talk about conditions in your community that create barriers to health, rather than simply focusing on one specific health issue. This also opens the door to highlight solutions. What changes are you and your partners working on to address those barriers? Another important messaging consideration that Amanda highlighted is to call attention to differences that exist within your county. And this is important for all counties, but can be especially helpful for higher ranking counties. So you might think it's easy if you're ranked up in the top quartile, but that actually comes with some of its own challenges. You may not feel like there's a sense of urgency or like it's harder to find a compelling story. But when you look a little deeper, you may find differences in opportunity and outcomes within your county. And this is part of your county's story too, and may help to move people past complacency to action. So as Amanda mentioned earlier, we provide data for some measures that is broken down by race. Children in poverty is one of those measures. In Dane County, Wisconsin, where the University of Wisconsin Population Health Institute is based, the overall rate of children in poverty isn't too bad. But when we look at the numbers by race and ethnicity, it's quite alarming. The percentage of Black and Hispanic children living in poverty is more than 7 times that of white children living in poverty. Closing this gap is something many people in our community are focused on right now. And the state reports also have a focus on equity and gaps by race and place. And these state reports can be used at the local level to bring an equity focus to the conversations you are having. So what do the differences look like in your county or your neighborhood? By race and ethnicity, who doesn't have the same opportunity to live their healthiest life? And how can that be part of your messaging? Once you know who you're talking to, your audience, and what you're going to say, your message, you get to decide how you'll deliver your message. So you can connect with the media by sending out press releases or contacting your local media outlets directly. Our communication partners work with folks in each state to help get the message out about the rankings each year, resulting in significant media attention at the national, state, and local level. And we encourage you to also do some proactive outreach with local news outlets to draw attention to health and any work that you're doing to improve health in your community. You can also write letters to the editor or an op-ed. And this is a great way to engage your partners in telling your story. And of course, social media is also an important way to get your story out to the community. You can also consider hosting a community meeting to share the data and to hear how these issues look and feel in the community. This is an opportunity to both share and to listen to what the data looks like in your community and feels like in your community, and to hear the context that brings that data to life. You can make presentations to your local Board of Health, county board, or community groups. And at the state level, groups have also held meetings with legislators, sometimes at legislative breakfast or event, and sometimes they've just gone and done individual visits to specific legislators to share either the state report or county level data. And finally, one-on-one conversations can also be a powerful way to connect with potential partners, a community member, or a decision maker. So as you prepare for the 2019 rankings release, we encourage you to take a little bit of time to think about who needs to hear your message this year, why, and what are you going to say? And finally, how will you deliver that message? I know we want to make sure we get back to questions. Joe, I wonder if you can just give us a couple of highlights of what you're seeing about which groups people are interested in reaching out to as we get ready to transition to questions.
Yeah, Karen, thank you. It might be easier to share which groups they're not interested in connecting with. A great collection of decision makers, from mayors and city councils to tribal councils, libraries, MEDA,
Nice.
showing, educational institutions. So lots of great ideas.
Great. Thank you so much. And thank you all for sharing your thoughts about how you'll use these rankings this year to reach out to new folks, new audiences. So as you continue to put your questions in the Q&A box and we transition to a few minutes of question time with Amanda, I want to thank you for joining us today and let you know how important your feedback is to us. Joe is going to be chatting out a link now to a brief survey about today's webinar. I'm going to suggest that you click the link now so you have it open in your browser and so you can fill it out a little later. We look at your feedback closely and we use it to improve our webinars. So thank you in advance for sharing your thoughts with us. All right, we covered a lot of ground during today's webinar. What questions do you have either about what I have shared or what Amanda shared? I'm going to ask Joe to go ahead and get those discussion group links out to folks so that as a reminder, you can join us for more time for questions in those discussion groups after the webinar. And Kate, how are we doing? What questions do we have?
Yep, we have a handful of questions coming in. So just a reminder, click on the survey link now, click on the discussion group link in just a few minutes when we're done with the Q&A. And
Yes,
if you had some
point.
of the very specific data questions, that would be a great opportunity to join those discussion groups if you want to dig a little deeper into some of those nitty-gritty pieces. But some questions that might be helpful for the full audience. We had a question about how does the rankings handle missing data?
Sure. So the rankings, that's kind of a two-part question in some ways. So what is ranking? What is missing data? Let's say that's part of it. Sometimes our data providers simply don't have data for certain counties, either because maybe too small sample sizes, not enough events happening in their community, and sometimes we or the data provider choose to suppress certain estimates because of privacy or uncertainty. So when you get to those points of seeing a blank spot in your rankings, you might also ask, well, how are those dealt with when calculating the rankings? And probably the simplest way to describe how it's dealt with is they're essentially assigned the state mean. So if you are missing a value in your county, the input value is essentially the state mean value, which might kind of bring your county's rank slightly more towards the middle. But we do that because it's kind of the best information we have about your community is its state value.
All right, thanks, Amanda.
Mm-hmm.
So we have another question that we get a lot, not just on the webinar, but given the opioid crisis, it seems odd to not have a measure that involves that. So can you talk a little bit more about what we do have and or why we don't have a specific opioid measure?
Yeah, that's a great question. So we do have a measure of opioid, overdose-related deaths as an additional measure. Unfortunately, or in some ways fortunately, there are not enough deaths nationwide for us to provide that data for a majority of counties throughout the nation, or a large majority. And if you remember, I discussed some criteria for inclusion of measures as a ranked measure, and we really feel strongly that we need to include measures that most counties have values for if we're going to rank on those measures. I will note that we do rank on injury deaths in one of our values, and overdoses are among injury deaths and are the fastest growing injury death cause. So much of the change in injury deaths is likely due to changes in overdose deaths. So there is some additional data. Sometimes in the causes of death, you will see overdoses. You will see something called unintentional injuries as one of the top 5 causes. Many of those are overdose deaths at this point in many communities. But unfortunately, we just don't have a consistent source of data for this. I will note that in meetings I've been attending on health data, this is an important issue for groups like the CDC, and discussions are ongoing about how to provide more consistent local data for communities as they're fighting this opioid epidemic throughout the nation. So hopefully this won't be the case that we don't have this data moving forward, that we have more information about not only overdose deaths, but people's usage of these drugs throughout the nation.
All right, I think we maybe have time for one more question on the webinar. You know, you've mentioned, Amanda, that we now are working to provide more data on race and ethnicity. Will there be any other demographic breakdowns beyond race, for example, data on LGBTQ population?
Not that we are not providing anything like that this year. I will note that our new sections about digging deeper do provide all of the links that we know are available to understand ways to subset our measures, to look at different subgroups of our measures. As you are going into the new documentation, make sure you look at that area, because if there is a source for that, we do try to include it. In addition to that, we also maintain lists of state-specific resources, which sometimes can go into much more specific detail about who is experiencing certain health factors or health outcomes. And those lists of state-specific data sources can be a great place to start on this. I know that's not a definitive answer, but we're really trying to provide what is feasible right now for us. So thanks for asking that. We have been hard at work on it.
All right. Thank you, Kate, for sharing those questions, and Amanda. As we've said, we will have time for more questions if you are able to join us for the discussion. So a couple more details about that discussion. We will be continuing the discussion and Q&A immediately following today's webinar in 2 extended Q&A sessions. If you have more questions about data, join Amanda and Kate to continue the discussion about data resources. If you have more questions about using the rankings to engage your community or work with the media, then join me and Annie to continue that discussion. If you have questions about or want to discuss both, either room will work. These post-webinar conversations give you the chance to be face-to-face with other attendees and to share what you are doing locally, as well as ask questions of us and other participants. They are intended to be interactive face-to-face discussions, so be ready to turn on your webcam and unmute your microphone. We invite you to share your experiences and ideas for the upcoming release with us during that time. I think Joe has chatted those links out again, and those will take you directly into the Zoom room. And we also want to let you know about our upcoming webinar on March 12th, where you can learn more about one community's path to creating healthy and equitable opportunities. This webinar will feature guests from Eatonville, Florida, home to the oldest incorporated Black community in the United States. Eatonville is a 2018 winner of the RWJF Culture of Health Prize. And leaders in this Florida community came together to understand the many factors that influence health and to address barriers to opportunity. This webinar will inspire you to take action and engage other partners to address the multiple drivers of health in your community. Register at countyhealthrankings.org/webinars, and we hope to see you there. And we always invite you to stay connected with us by liking us on Facebook, following us on Twitter, or signing up for our e-newsletter. Thank you so much for your time today, and we look forward to talking with you more over in the discussion groups, and we will see you there.
Thanks,
Thank you.
everyone.